Hello and welcome to this episode of The Fire Escape, where we dive into important discussions that shape public health and policy. I'm Bryan, and Hazel Lincy is joining me as my co-host. Today we're tackling a crucial topic, tobacco harm reduction. By comparing two very different approaches, Kenya's restrictive policies versus Sweden's harm reduction model. To help us analyze the findings from the Smoke-Free Sweden comparative report, we are thrilled to welcome our special guest and co-author of the report, Joseph Magero. Joseph is the chairman of the Campaign for Safer Alternatives. He has been at the forefront of advocating for harm reduction in Africa, and today we'll ask him key questions about challenges and opportunities in Kenya's tobacco control landscape. How can Kenya learn from Sweden's success? Are Kenyan policymakers missing a life-saving opportunity? And what does the future hold for safer nicotine alternatives in the country? Stay tuned as we unpack these pressing issues. Hello, Joseph.
Hi, Bryan. Hi, Hazel.
Hello.
Would you mind introducing yourself a little bit there? And what are you currently busy working on? What are you busy advocating?
My name is Joseph Magero, chairman for Campaign for Safe Alternatives, and currently we're working on a project in Nigeria and Zambia where we're looking at the same policy issues we're facing here in Kenya. So I'm glad to be with you today.
Thank you.
Very interesting.
So Joseph, if I can ask you, what are the biggest misconceptions among Kenyan policymakers regarding harm reduction strategies?
Thank you, Bryan. So there's a few challenges we're facing here. The first misconception I can come up with is the equating harm reduction with endorsement of tobacco use, where many policymakers believe that harm reduction encourages tobacco or drug use rather than mitigating risks. There's also the issue of misinformation on nicotine, where there's a widespread belief that nicotine is the primary cause of smoking-related diseases, rather than the harmful chemicals produced by combustion. So many policymakers in Kenya treat all nicotine products as equally harmful. We also face the challenges of is a scientific approach, where many see harm reduction as a moral issue rather than a public health strategy. And this leads to a resistance against any evidence-based policies. And lastly, there's also an over-reliance on WHO and Bloomberg-funded narratives where policymakers often adopt anti-vaping stances promoted by international organizations such as CTFK and the FCTC, without critically evaluating local context and independent research.
Great. All right. Thank you. Hazel, to you.
Thank you so much. Yeah, Joseph, thank you for being an author for such an interesting and powerful report. And I think one of the base powers of this report is that it's based on statistics. It's based on facts, right? And one very interesting fact as part of this report was Kenya's female smoking rate, which we found to be quite low. It's at 0.7%. And this is often attributed, at least partly, due to strong social taboos that don't allow for reporting. So how does this kind of stigma impact accurate data collection on tobacco use among women?
Thank you, Hazel. I think stigma impacts accurate data in many ways. You can come up with, like, for example, there's a lot of underreporting where women may underreport tobacco use due to social stigma, and it leads to inaccurate prevalence data. There's also the fear of judgment from interviewers or family members. It also results into having misleading reports. Most women almost, they always align their answers with society's expectations rather than truthfully disclosing usage, because that also leads to a lot of limited participation, where some women just may avoid participating in studies altogether. Because as you may know, there's a lot of hidden consumption. Women use, some women in Kenya use tobacco secret. In conservative societies such as ours, discussing a woman's tobacco use is taboo, and this limits a lot of research opportunities.
Yeah, thank you for sharing, Joseph. I think that, as you said, it adds to the taboo around the topic, which in turn makes it so much harder to bring to light and address and deal with. And that's very important to know as well. Yeah, thank you so much. Bryan?
Joseph, earlier you mentioned that often safer nicotine alternatives are equated with combustible tobacco, which often leads to misconceptions and such. So if Kenyans who wanted to transition to safer alternatives today, what challenges would they face regarding access and information?
Thank you, Bryan. Well, in terms of access, I would say most of the products in the market are really unregulated products, and you always find them in the black markets. The second challenge they would face is a lot of regulated products are really costly, and they're way too expensive for most of the people that smoke, so they would rather just stick to the regular cigarette. And also, as I did not mention this, we had the graphic displays on nicotine products. It was gazetted last week, and most the is really misleading, and this is discouraging even more smokers from trying the product. So there's a lot of challenges that we're facing at the moment, and I believe that with proper regulation and us emulating Sweden, as the report shows, we can be able to mitigate some of these.
Great. Yeah, definitely. So having access to information, to accurate information, also makes a world of difference in terms of how people can approach their cessation journey. So thank you very, very much for pointing that out, Joseph. Hazel, if you would.
Yeah, thank you. I think we're really starting to get a much bigger and clearer picture of the situation in Kenya and how complex and layered it is. And I think part of that is tobacco harm reduction. We pride ourselves in being scientific and evidence-based, as you said in the start. But that doesn't really work if the authorities are not open to looking at that evidence or believing that evidence or, relying on that. So despite the clear difference in harm levels, I mean, research shows e-cigarettes are anywhere from 95 to some even say 99% less harmful than than tobacco cigarettes. So despite the clear difference in harm levels, policymakers in Kenya often treat nicotine alternatives the same as cigarettes. So my first part of the question is, why do you think this is? And the second is, how receptive are authorities to evidence about nicotine-based products and tobacco harm reduction?
Thank you. Why I believe this is, there's three things here. The first is, I think there's plenty of misinformation that is out there when it comes to tobacco and nicotine, and them not knowing the difference. But mainly there's the influence of the WHO and the FCTC in terms of the guidelines which they give governments such as ours when it comes to regulation. And lastly, there's also the influence of anti-tobacco organizations. Remember, there's only a few of us here in Kenya that talk about harm reduction, like there's myself and a couple of people maybe. So your second question is, you asked me if there's any biases and how we can overcome these biases. I think, of course, policymakers are very skeptical. There are few of us that share THR information, And like I mentioned, there's also the WHO biases, and how we can overcome this, I believe, is through testimonials, where we can collect as many testimonials as we can in the country of people who've used the product to quit smoking, and maybe we share this with the policymakers, and this can maybe paint a clearer picture of what we're talking about and how they can maybe form the policy that can assist some of the people like this.
Thank you, Joseph. Absolutely. I mean, at the end of the day, these policies are for the people. So testimonials are very important and strong in this. And I think another element of it is also seeing success in other countries. So we'd love to talk a little bit about Sweden now, and Sweden and Kenya. Bryan, I think you have a question for us on that.
Well, thank you very much, Hazel. Absolutely. Especially, well, nicotine alternatives are usually received by a lot more by the consumers, who understand that through their cessation journey, they themselves wanted to quit, and cold turkey is very ineffective. So in in Sweden, through the use of snus, a lot of the cultural, being embedded in the culture, they use safer nicotine alternatives, and it has benefited them greatly. So they have this information readily available. So Joseph, in Sweden, advertising of safer nicotine alternatives is allowed to raise awareness. So would a similar approach work in Kenya, or would there be too much opposition?
Thank you, Bryan. Unfortunately, right now, advertising is totally banned in the country. You cannot advertise tobacco or nicotine products. However, I had shared with you this before. I think what we can do in the country is perhaps like where people buy cigarettes, and the people who buy cigarettes in packs, we can maybe print a card that has information on nicotine and safer nicotine products, and slip the card into cigarette packs. So smokers who buy these packs can then open and access this information. That's really not advertising, it's just providing scientific information. And I believe that's one of the ways that maybe we can look at here in Kenya as a way of maybe giving out information to raise awareness to people that it really matters to the most. It's not for the general public, like I said, it's for people that use cigarettes that need information on safer nicotine products. So that's one of the methods I think we can use.
That's very interesting, Joseph. I didn't know about the cigarette packets.
Yeah.
Wow. Yeah. So there's a vast difference between Sweden's approach, which is just the regulatory approaches of raising awareness of safe and nicotine alternatives, compared to tobacco cigarettes. And essentially, Sweden is nearly smoke-free.
Mm-hmm.
So, yeah, absolutely, there's a vast difference. Hazel, do you have any more for us?
Yes, absolutely. Joseph, I think as someone who's from what is known as the Global South myself, I completely see and already know that people's arguments, which are valid in their own way, are going to be, how can you compare Kenya and Sweden? They're very different socioeconomically, very different culturally. We've talked about culture already earlier in this conversation. And it's true, we already know that LMICs, lower and middle income countries, face different and in some ways bigger challenges than other countries in doing tobacco harm reduction. So they are very different. However, I think we can agree that there are also many learnings from Sweden that can apply to any country, including Kenya. So with this, I'd love to know what you think of the comparison between Kenya and Sweden, why these were put together, and the ways in which Sweden can be aspirational, something we look up to, without being, an impossible goal, completely unattainable. How do we balance that?
think, first of all, comparing Kenya and Sweden is not far-fetched. First of all, Kenya, we use a lot of oral tobacco, so the concept of using oral nicotine product is not something that will take a lot of time for anybody that uses tobacco to understand. So in terms of policy adjustments, yes, I believe with policy adjustments, Kenya may not have maybe Sweden's economy, but adopting a harm reduction approach does not require huge investments. It just requires smarter regulations. I think by allowing and educating people about safe alternatives, Kenya can see major public breakthrough, and it will not cost any drastic financial burdens to the government. Policy is what we need to emulate from Sweden.
Great. Thank you so much for sharing, Joseph.
Yeah. Joseph. So if I may ask, so in this comparative report, the Kenya versus Sweden, what were some of your key findings within the report, and what stood out for you, and like why the need for it?
Why the need for it? Our numbers are not going down anytime soon. If you check the statistics, and Kenya's smoking rate is not going down faster. There's several factors that are affecting this. Number one is the illicit trade, and now we're getting cigarettes that are smuggled into the country from different regions. The government was overtaxing tobacco products in a way of reducing the smoking rates, but it's not working. So why we need to emulate Sweden is because Sweden looked at the consumer and trying to reduce smoking rates at the lowest cost to the government, and they did so by informing smokers, first of all, about the dangers of smoking and the differences between nicotine and tobacco, and how they can reduce their health risks by switching to products such as nicotine pouches and snus. And I believe this is the information that we need here in Kenya. That's what we are fighting for you to inform the smokers to have accurate information, and then secondly, for them to have access to nicotine products. That's a start I believe we need to look at as Kenya. And I'm happy because the best thing we did not do last week is the products were not banned in Kenya. The regulation just wasn't right, but at least it gives us a window where we can avail products to smokers at the moment. So yes.
Accurate information definitely it would be crucial in a cessation journey where anybody in Africa would like to keep, or if they would like to quit smoking. If there are alternatives, if there are an escape route for them to quit smoking without the struggles of quitting nicotine, using safer nicotine alternatives absolutely is a great tool to use. And I do hope that Kenya would have the same opportunity. Hazel, would you like to ask the last question for us?
I would love to. Thank you. Joseph, Bryan and I were having a conversation before this podcast, and we were talking about the name of the podcast, The Fire Escape. And it comes from an analogy that Dr. Delon Human, who we all know and admire, shares and talks about. And he talks about how for people who are smoking, we all know how low the rates of quitting cold turkey are, how tobacco harm reduced products can really be a fire escape for them and really provide a way out, a way towards cessation. And we've seen that effective in so many ways. And today you've given us a lot to think about. And I'd just like to maybe open our platform to you, keeping this fire escape analogy in mind. Joseph, is there anything you'd like to tell the listeners, the viewers, maybe people who are looking for alternatives, maybe policymakers who may be listening to this? What's a closing comment that you'd like to leave everybody with about THR, tobacco harm reduction in Kenya?
For policymakers in Kenya, I would like to say that we don't say these things out of the blues. I'm one of the people that quit smoking using, I started using electronic cigarettes, but now I use nicotine pouches and I love it. I've been smoke-free for more than 4 years. And I believe that they should listen to us, people that have experience in this struggle with tobacco. For me, starting to smoke at the age of 15 and up to a few years ago, trying to quit cold turkey has not been easy. And that's the message that we're spreading for the over 4 million smokers in Kenya, that there's a different way for them to enjoy nicotine per se. So I think there's a lot of public education campaign that is needed in Kenya. There's a lot of policy reform that we can do. We are open to working with regulators to ensure that laws reflect scientific evidence and do not block access to safe alternatives. And we also would like to ask to encourage responsible reporting by the media. And journalists should report with accurate data and expert sources. That's the message I have for the policymakers.
Thank you very much. Thank you very much, Joseph.
All right.
So it's great. Well, thank you everyone for tuning into the Fire Escape. We hope today's conversation with Joseph Magero shed some light on the challenges and opportunities in tobacco harm reduction. If you enjoyed this episode, don't forget to subscribe, share, and join the conversation online. Until next time, keep questioning, keep learning, and keep the conversation going. Stay safe and smoke free.